In this video, we discuss the evidence suggesting that two anti-diabetes drugs may be able to reduce cerebral edema. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Edema is swelling caused by excess fluid trapped in the tissues. Cerebral edema is a major danger associated with the development of any kind of brain cancer or even the treatment of brain cancer. Any kind of direct attack on a tumor, such as radiation, can cause swelling before the tumor's destruction. So, any type of treatment decision for the brain has to balance the benefits of attacking the tumor with any potential danger caused by swelling. An investigational option to improve cerebral edema is intravenous Glyburide, an anti-diabetes medication for which over 2 million Americans have a prescription. A similar anti-diabetes drug, Glipizide, for which 13 million Americans have prescriptions, shows similar promise. Glyburide and Glipizide target the sulfonylurea receptor 1, SUR1 protein. SUR1 is not continually expressed under normal circumstances, but only becomes activated when intracellular ATP is depleted, primarily through some kind of cellular damage. The activation of SUR1 leads to cell depolarization and edema. In one trial of people with malignant edema and stroke, 41 people received IV Glyburide and 36 received placebo. The Glyburide group experienced a mortality rate of 2.2%, while the placebo group experienced a mortality rate of 22.2%. The Glyburide group also had less midline shift, a measure of edema, and lower matrix metalloproteinase 9, MMP9 levels. MMP9 is associated with both increased metastases and edema. The Glyburide group experienced fewer symptoms of stroke. Glyburide has also been found to improve long-term recovery from stroke. A retrospective analysis compared diabetic patients who had a stroke. 36% of patients who received a sulfonylurea medication, such as Glyburide, had a 4-point decrease on the 10-point symptoms of stroke scale, compared to just 7% who received a different type of diabetic medication. Also, 82% of patients who received a sulfonylurea achieved functional independence, compared to just 57% who received another type of diabetes medication. Another human trial examining cerebral edema caused by traumatic brain injury found that lesion volume, hemorrhage plus edema, increased 136% with IV Glyburide administration, while increasing 1,036% with placebo. Edema caused by a stroke or brain injury is different from edema caused by brain tumors, which is known as vasogenic edema. Glyburide has also shown that it can decrease the water retention associated with vasogenic edema in humans. An animal trial also found that Glyburide was significantly more effective than dexamethasone, a steroid, at reducing cerebral edema in both small cell lung cancer and melanoma brain tumors. One human trial mentions offhandedly that Glyburide had been enterally administered, absorption through the gastrointestinal tract, such as caused by oral consumption, to reduce cerebral edema in 25 brain cancer patients, but there is no mention of functional or survival outcomes. SUR1, the membrane protein inhibited by Glyburide, has been found to be overexpressed in brain tumors with childhood cancers, medulloblastoma, and ependymomas, having about twice the expression of glioblastoma and brain metastases. Therefore, SUR1 inhibition might be particularly useful for medulloblastoma and ependymoma. Oral glyburide is most pharmacologically active when taken on an empty stomach. The presence of glyburide spikes in the blood about 3 hours after oral administration, then rapidly falls off. IV glyburide was developed to allow for constant blood levels. Lastly, inclining the head of the bed 30 degrees can help relieve any pressure edema may be causing. For a further discussion on glyburide and glipizide and cerebral edema, please see the book Cancer Self-Defense 101. Quick tips to help you survive.